The pharynx, larynx, and soft palate. The pharynx is a shared passageway between the respiratory and digestive systems. Ingested food and inspired air cross paths. It is divided into the nasopharynx, oropharynx, and laryngeal pharynx. The muscles of the exterior pharyngeal wall are the superior, middle, and inferior constrictor muscles. They are circularly arranged and overlap in order to cause peristalsis. The stylopharyngeus muscle is longitudinally arranged, and it elevates and widens the pharynx during swallowing. The superior constrictor muscle originates in the pterygomandibular raphe, which has a common attachment with the buccinator muscle. It inserts in the pharyngeal raphe, as do all of the constrictors. The middle constrictor originates on the hyoid bone and the stylohyoid ligament. The inferior constrictor originates on the cricoid cartilage and the thyroid cartilage. All of the constrictors are innervated by the vagus nerve. The stylopharyngeus muscle originates on the styloid process of the temporal bone and inserts into the lateral wall between the superior and middle constrictor muscles. It is innervated by the glossopharyngeal nerve. The nasopharynx is located posterior to the nasal cavities. The oropharynx is located posterior to the oral cavity, and the laryngeal pharynx is located posterior to the larynx. The nasopharynx is separated from the oropharynx by the soft palate. The nasopharynx is separated from the laryngeal pharynx by the epiglottis. The nasal cavities are separated from the nasopharynx by the choana. The pharyngeal tonsils are located in the pharyngeal recess of the nasopharynx. The oropharynx is composed of the fauces, which are the anterior and posterior tonsillar pillars, the palatine tonsils, and the uvula. An arch is formed by the union of the two anterior tonsillar pillars and the union of the two posterior tonsillar pillars. The palatine tonsils lie between the anterior and posterior tonsillar pillars on both sides. The lateral wall of the fauces consists of the palatoglossal fold and muscle, the palatopharyngeal fold and muscle, and the palatine tonsil. The lingual tonsils are located on the posterior third of the tongue. Notice the relationship of the anterior pillars, posterior pillars, palatine tonsil, and lingual tonsils. The sulcus terminalis is the dividing line between the oral cavity and the oropharynx. The soft palate is made up of the tensor veli palatini muscle, the levator veli palatini muscle, and the uvular muscle. The vagus nerve innervates all of the palatal muscles, except the tensor veli palatini muscle, which is innervated by the trigeminal nerve. This is an image of the laryngeal pharynx. Note that the larynx is not inside the laryngeal pharynx. Ingested objects can also become trapped or lodged in the piriform recess. This is an image of the laryngeal cartilages, which include the epiglottic, thyroid, cricoid, and arytenoid cartilage. The median cricothyroid ligament is the entrance point for an emergency airway procedure. The difference between a cricothyrotomy and a tracheotomy is that a cricothyrotomy is the incision of the skin and the median cricothyroid ligament for emergency entrance into the airway. Tracheotomy is the incision of the skin and membrane separating the cartilages of the trachea for emergency entrance into the airway. The internal structures of the larynx include the vestibular folds, the vocal folds, and the glottis. The rima glottitis is the small slit opening between the vocal folds. The vocal ligaments produce sound, while closure of the vestibular folds prevents the movement of air into and out of the larynx. Closure of the vestibular folds increases abdominal pressure for exercise and excretory functions.